Hello guys, so this is Dr. Krishna and today we shall be discussing another important topic and the most commonly you see this condition in your clinics, that is diphtheria, right? So all of you very well know that what is the causative agent of diphtheria, that is Corynebacterium diphtheriae. So we shall be discussing the general properties of Corynebacterium diphtheria, we shall be discussing the structure, and most importantly we shall discuss the pathogenesis in very much detail, right? And after that we shall be discussing the symptoms, signs and symptoms, and finally the treatment part, right? So we shall be mainly focusing on the high yield stuff, okay? So let's get started. So Corynebacterium diphtheriae. So first of all, whether this is a gram positive bacteria or gram negative bacteria. So let me, as I already told you, so let us start with the general properties. Corynebacterium diphtheria, this is, first point is, this is a gram positive bacteria, right? So Corynebacterium diphtheriae is a gram positive bacteria. The second thing is, this bacteria is aerobic. What do you mean by aerobic is, this bacteria survives in the presence of oxygen. And third important thing is, unlike Clostridium species, this bacteria do not form any spores. You know, in Clostridium species like Clostridium tetani, difficile, pharyngeus, botulinum, all these Clostridium species were forming spores. And these spores are so toxigenic, some of the spores are even neurotoxic. So in the same way, this Corynebacterium diphtheria do not produce any spores, right? So unlike Clostridium species, Corynebacterium diphtheriae do not form any spores. So it is a non-sporing organism. Corynebacterium diphtheria is a non-spore forming organism. And fourth importantly, can this bacteria move? No. This bacteria do not have any kind of flagella. So as they do not have any kind of flagella, they are non-motile. So this is a non-motile bacteria. And another important thing is, as I'll show you the picture of this Corynebacterium diphtheriae. As you can see in this, how is it look? How is the picture? Let me draw it in a simple format. So this is the bacteria over here, right? And on either ends of the bacteria, you have got these structures, these round bud-like structures, right? So this is the basic structure of Corynebacterium diphtheriae. By looking at this, tell me what is the shape? The shape is cocci or rod-like shape? Obviously it is rod-like shape. So can I call this is a gram positive bacteria, which is bacilli, gram positive bacillus? Yes, this is a gram positive bacillus bacteria. Next thing is, look at the bacteria here. One bacteria is different from another bacteria. I am not telling completely different, but look at the size. Compare the size of one bacteria with another bacteria. Compare the shape of one bacteria with another bacteria. So within this slide, no two bacteria are having same size and same shape. They are different. So if within a slide, if there are 3 or 4, 5 or 6 different shapes and different sizes of the same bacteria, right, that character is called as pleomorphism, right? So these bacteria are pleomorphic bacteria. These bacteria are pleomorphic bacteria. What do you mean by pleomorphic bacteria? Yes, pleomorphism means bacteria, the cells, all these bacterial cells are having different shapes and different size. Different shapes and different size, right? Next thing, looking at the structure of the bacteria. So these bacteria are placed at right angles with each other. Some of the bacteria are located like this, some bacteria are located like this, some bacteria are located like this. So overall, as you can see this bacteria, look at this region guys, look at this part here, and not only that, look at, this part. Aren't they looking like Chinese letter, right? All these bacteria, they join together and form like a Chinese letter. If you ask me, are they in the form of a chain? No. If they are in the form of a chain, I have to call it as strepto. Are they in the form of in a cluster? No. If they are in the form of cluster, I have to call them as staphylo. But they are not in a chain, not in a cluster. They are randomly, irregularly, in a haphazard position. They are located as they want, right? So they are located in the form of a cuneiform shape or Chinese lettered shape. So these bacteria, point number 6, they are cuneiform or Chinese letter pattern shape. Chinese letter pattern shape. Right? So this is the basic things which you need to know, the general properties which you need to know regarding the Corynebacterium diphtheria or the C. diphtheria. Okay, how many types of Corynebacterium diphtheria are there and what can you tell about them? So this will be very important for your exams, guys. Corynebacterium diphtheriae, how many types are there? Basically, we have got C. diphtheriae, Corynebacterium diphtheriae gravis, right? We have also got Corynebacterium diphtheriae intermedius, and we have also got Corynebacterium diphtheriae mitis. So these are the three basic types. I mean, there is also one more type, but that is not that important. But these three, they are pathogenic. You know, they have good severity to cause a disease. So Corynebacterium diphtheriae gravis, Corynebacterium diphtheriae intermedius and Corynebacterium diphtheriae mitis are the different types of Corynebacterium. Now, if you ask me what is the importance of this, the importance of this is, out of these three, Corynebacterium diphtheriae gravis is the most severe form. The next one is mild severe, not mild severe, I can tell it as moderately severe. Moderate severity, and the final one has got mild severity. So if you want me to judge them based upon the severity, this is the thing, right? Now you can ask me why gravis is so severe and why mitis is mild severe. What are these bacteria actually causing to us? What are these actually causing to us is this gravis. Why it is so severe? Because once you are affected with Clostridium diphtheria gravis, you are going to end up having hemorrhage as well as paralysis. Okay, so you are going to end up having two things. One is hemorrhage, so we call it as hemorrhagic form, and we also call it as paralytic form because you also end up having paralysis. But whereas moderate form, you only have hemorrhage. But whereas mild form, it obstructs your respiratory tract. It is an obstructive form. Okay. So basically, what are the different forms you have here? One you have is the hemorrhagic and paralytic together. That is why it is a severe form. And next one is you have your hemorrhagic form, and after that you have got your obstructive form. Right? So these are the three important things which you need to know of these bacteria over here. Right? So this is based upon the severity. Now if you ask me, what are the risk factors? Which group of people are most commonly affected with this Corynebacterium diphtheriae? So if you want me to mention the risk factors, which group of people are, the first thing is those group of people who are immunocompromised. And second group of people are those group of people who are unvaccinated. You know, diphtheria have even got vaccines, DTaP, Tdap, TD. So these are the vaccines. We shall be discussing it in a minute. So these are the vaccines. If you are unvaccinated in your childhood, right, you basically have to receive 3 doses. One is DTaP, Tdap and TD. So 3 times in your lifetime you have to receive these vaccines. And if you did not get vaccinated, if you are unvaccinated, then you are more likely to develop this Corynebacterium diphtheria. Fine. So let us say I am an immunocompromised patient, or let us say from my childhood onwards no one educated me to take a vaccine, or we were afraid of, my mother was afraid of vaccine, so I did not take any vaccine. Can you tell me how am I going to get infected with this Corynebacterium diphtheriae? How are you going to get infected is that, how is this getting transmitted to you? How this is getting transmitted to you is that, two ways guys, two ways. One way is that, for example, I got Corynebacterium diphtheriae and you're sitting in front of me and I cough. When I cough, what is that thing that enters into your body, into your respiratory tract? Obviously, respiratory droplets. The respiratory droplets from my side, from an infected person to an uninfected person. So, respiratory droplets. Respiratory droplets. Other than this respiratory droplets, is there any other way? Yes. For example, let us say I met with an accident and there is some open skin lesion. Open skin lesion. Okay. So, two ways. One way is respiratory droplets and other way is open skin lesion. If for example, let us say from you, right, there is a patient sitting in front of me and he is a patient of Corynebacterium diphtheriae, he got affected and he talks to me. So, in this conversation, the respiratory droplets enter into my respiratory tract and now I am going to be affected with that type of diphtheria which is called as pharyngeal diphtheria. Pharyngeal diphtheria. Next, if I got an injury and some open skin lesion, if I get affected with the diphtheria, and that diphtheria is called as cutaneous diphtheria. So, if someone asks you, hey, can you tell me what are the different types of diphtheria? Yes, one is called as pharyngeal diphtheria and another one is called as cutaneous diphtheria. These are the two different types of diphtheria, right? These are the two different types of diphtheria. Right. Next important thing is that, as I was discussing the general properties of these bacteria, right? In the starting, I was discussing the general properties of the bacteria and I was telling you, as I was discussing, I was telling you that this is the shape of the bacteria like this, right? On either sides of the bacteria, you find, on either sides of the bacteria, I was telling you, you find some dark spots like this, club shaped spots on either side of the bacteria, right? Now, what are these bodies over here? What are these club shaped parts over here? So, these club shaped parts which you can see right now, these are nothing but called as metachromatic granules. These are called as metachromatic granules. Metachromatic granules. Why do you call them as metachromatic granules? Why do I call them as metachromatic granules is that, listen very carefully. For example, there is a bacteria here, not Corynebacterium, there is some other bacteria here. Now, when I add a dye to that, for example, I am adding, let us say, red color dye to that. And I wanted to see if there is bacteria really there in that agar plate or not. So, I am adding a red color dye. Now, when I add a red color dye, the bacteria will take up that dye and it will exhibit out, right? So, even that bacteria will exhibit out as reddish colored bacteria or light reddish color bacteria or dark reddish color or pinkish color bacteria. I mean, if I am adding red color, obviously that bacteria also will show up red, but with different intensities. Either it can show up dark red, light red, or it can show up pink, right? Now, if I am adding blue color, the bacteria will show up blue. The bacteria will take that blue and it will exhibit out blue. It can be light blue, it can be dark blue. So, but whatever it is, even though the bacteria is exhibiting different types of intensities, but overall the bacteria is exhibiting the same color which you have added, right? So, this happens for the most of the bacteria. But this bacteria, why it is called as metachromatic, why it has got metachromatic granules is that, you add blue color to it, instead of showing up some intensity, some degree of intensity of blue color, instead of showing up that, this bacteria will show up a different color. So, I add blue, the bacteria will glow up as red, right? So, I am adding blue color dye, but the bacteria is showing up as red color colonies. So, this feature is called as metachromasia, and the dye which I am adding is called as metachromatic dye. Okay, so you understood what is the meaning of metachromatic granules, right? Now you can ask me, what is exactly located in these granules? What is exactly located in these granules is that these metachromatic granules will have phosphate in that. Okay, these metachromatic granules are having phosphate. Right. And another important thing which you need to know is, other name for these metachromatic granules are volutin granules, and other name is Babes Ernest granules. Volutin granules, Babes Ernest granules are also the other name for these metachromatic granules. Now don't confuse with Babes negri bodies. Babes negri bodies are seen in anthrax, but these are Babes Ernest granules. Okay, so what I was telling you is, for example, if I add methylene blue or toluidine blue, if I am adding methylene blue, or if I am adding toluidine blue, so the bacteria basically it should exhibit also blue color, but this bacteria will completely exhibit a different color, that is reddish. So this explains the metachromasia nature of these granules. Having discussed this, now we shall discuss another important thing. So we are done with the discussion of the transmission, the risk factors, the different types of bacteria, different types of Corynebacterium diphtheria based upon severity and why so. We have also discussed the basic characteristics. Now we shall discuss the pathogenesis of this bacteria. All of you pay attention, don't make any kind of notes while I am discussing the pathogenesis. Right. First of all, how this bacteria enters into your body, right? How this bacteria is toxigenic. Okay. Now listen very carefully. There is something called as Corynebacterium bacteriophage, right? So there is something called as bacteriophage. So that bacteriophage is also called as beta bacteriophage. So let me draw a simple picture. Okay. So this picture which I am drawing right now in front of you, this picture is nothing but called as the bacteriophage, right? So this is called as bacteriophage. Now this bacteriophage, the name of this bacteriophage is beta bacterio. The name of this bacteriophage is beta bacteriophage. Now this beta bacteriophage, where is it going to sit? Where is it going to sit is, there is a bacteria. I'm just drawing it simply, guys. I'm just drawing it simply, that I am just drawing the shape of the Corynebacterium diphtheriae. Actually this is not the shape of Corynebacterium diphtheriae, but anyways just think that this is the shape of Corynebacterium diphtheriae. So this is a bacteria of Corynebacterium diphtheriae. So this bacteriophage, beta bacteriophage, is lodging on the Corynebacterium diphtheriae. Fine. So it has got its legs as well. All of you know very well now, right? Finally, it is getting lodged onto this bacteria. So when it will get lodged onto this bacteria, what is it going to do? What is it going to do? All of you know what is the function of bacteriophage. What does it do basically, guys? What does it do is that this bacteriophage has got a genome in it. This is called as the genome of, or the genetic material of the bacteriophage. Now within this genetic material, I am drawing small dots over here. These dots are nothing but called as tox genes. Okay, so this bacteriophage is having a genome, and this genome is having tox genes. These are having tox genes. So now slowly these tox genes are slowly inserted inside. I mean, what do I mean is that this genome, the bacteriophage genome, slowly gets inserted into the bacteria, the Corynebacterium diphtheria. So this is your C. diphtheriae. C. diphtheriae, right? And this is the genome of C. diphtheriae. Now, as the genome of the bacteriophage enters inside, this genome attaches with your original genome of the bacteria. So what will happen? Tell me what is going to happen. What is going to happen is these tox genes which are located are inserted with the genome of the Corynebacterium diphtheria. Simple thing, guys. Nothing much has happened here. Beta bacteriophage has got its own genome, and that genome has got tox genes. Okay. So when it will sit on the cell Corynebacterium diphtheriae, all that genome, through that it will enter inside the bacteria and it will merge with the bacterial genome. After merging with the bacterial genome, what it will do? Tell me what it will do. The tox genes will activate the entire bacterial genome and it will make the bacterial genome to code for, tox genes will make the bacterial genome to code for a toxin. What is that toxin? It will code for a toxin, and that toxin is called as diphtheria toxin. Diphtheria toxin. And that toxin is called as diphtheria toxin, or simply DT. DT stands for diphtheria toxin. And by the way, mind you that this diphtheria toxin is an exotoxin. Diphtheria toxin is an exotoxin. So this is how an exotoxin called diphtheria toxin is formed. Okay, fine. So this diphtheria toxin is formed. So what is this diphtheria toxin going to do? What is this diphtheria toxin going to do is, now it is the time for diphtheria toxin to enter into your body, enter into the host cell, into your each and every cell and cause the disease. How is it going to cause? We shall be discussing now. Okay. So finally, we have successfully discussed what is diphtheria toxin and how is it produced, right? Right. Now this diphtheria toxin, let us say this is the host cell. This is the host cell. Now within this host cell, there is something called, yes, what is this, guys? What is this structure which I have drawn just now? This structure is called as ribosome. This is called as ribosome. And ribosome also has got another structure. This structure over here is called as EF2. EF2 stands for elongation factor number 2. What does elongation factor do, you know? What does elongation factor do? What does it do is, it will collect all the amino acids. Look here, this elongation factor will collect all the amino acids, and all these amino acids are arranged in the form of a chain like this, right? That is why it is elongating the amino acids. So you call it as elongation factor. So it will arrange all the amino acids like this, as simple as that. Okay. So after arranging all the amino acids like this, what will happen? A protein is formed. So can I tell elongation factor 2 is responsible for protein synthesis? Yes. Elongation factor is responsible for protein synthesis. Right. So what is it going to happen exactly? What is it going to happen is that if you look at the structure of DT, that is diphtheria toxin exactly looks like this. This is the structure of diphtheria toxin. Okay. This is the structure of diphtheria toxin. Diphtheria toxin has got two subunits. One is called as A subunit, another one is called as B subunit. Now look here, what is going to happen. The A subunit and the B subunit, both of them are attached to the host cell. What is it happening? The A subunit, the B subunit. A and the B subunit, both of them are attached to the host cell. The A subunit and the B subunit are attached to the host cell. Once they are attached, what will happen is the host cell will take them inside like this. For example, this is the A subunit, this is the B subunit. They are attached to the host cell, right? Now the host cell is taking them inside like this. Look here in the next picture. So this was your A subunit, this was your B subunit. So both the A subunit as well as the B subunit are right now inside. Now finally they are phagocytosed inside and form a vesicle here. Look here, how is it going to form? This is a host cell. This is the A subunit, this is the B subunit. A subunit and B subunit, like this, right? So finally what has happened? Look at the process, guys. Again I am going to explain them. Look at the process here. First of all, the A subunit and B subunit are attached to the host cell. It means your cell, your body cell and my body cell. And finally, it has taken up inside like this. After taking up inside, finally it formed a vesicle, and this vesicle is called as endosome. This vesicle is called endosome. So finally what is happening? Within this vesicle, the pH is drastically falling down. When the pH is falling down, can I call that within the vesicle, the acidic environment is increasing? Yes. So within the vesicle, what is happening? Within the vesicle, acidity is increasing. The acidity is increasing, which means the pH is decreasing. So what is happening as a result? What will happen is the A subunit and B subunit, both of them will separate. Okay. As a result, the A subunit and the B subunit, both of them are getting separated now. So what will happen? What will happen is that, look here very carefully now. This was your ribosome, right? This was your ribosome over here, right? And your ribosome was having what? Your ribosome is having a small protein there, and this protein was called as elongation factor 2. I told you in the starting. Now, once A and B subunit separate out, A subunit is very free. Very free in the sense it can diffuse anywhere outside. So what will happen? This A subunit will very happily diffuse out of the endosome. A subunit will very happily, it will diffuse out of the endosome. And keep in mind, A subunit is all the time attached with a molecule called as ADP. Okay. So now all these things, they slowly come like this and attach there. How are they going to attach? Look now. This was your A subunit, and this is a small vesicle outside that, and this is your ADP. ADP. Now where did ADP attach, guys? ADP got attached to EF2, that is elongation factor 2. Keep in mind one thing. The moment ADP attaches to elongation factor 2, this process is called as ADP ribosylation. ADP attaching to elongation factor 2. And this process is called as what? ADP ribosylation. Whenever there is ADP ribosylation, this ADP ribosylation will inactivate your EF2. It will inactivate EF2. Elongation factor has got inactivated now. When elongation factor has got inactivated, do you think will there be further amino acid progression? No. So when there is no further addition of amino acids, do you think a protein is formed? No. So there will be no protein synthesis. There will be no further protein synthesis. So this process is called as ADP ribosylation, which caused inactivation of EF2, and that resulted in what? That resulted in no protein synthesis. And what will happen when there is no protein synthesis? What will happen when there is no protein synthesis is the cell will die. There will be cell death. Okay. So when cell will die, what is going to happen? Is there any further process? Obviously, when any individual dies, if you are leaving them like that, so after some time they will decompose and there will be complete necrosis of the body. So the same is happening here. There will be what? Necrosis. There will be necrosis. Clear now? You understood what is going to happen here, right? So overall, let us club up all the things, guys. Let us very fastly club up all the things. Coming to the pathogenesis. Simple thing, there is something called beta bacteriophage. Within this beta bacteriophage, it has got its red genome, and red genome is having tox genes, right? Now this beta bacteriophage comes and attaches onto the bacteria. This is my bacteria. It comes and attaches to the bacteria. The moment it attaches to the bacteria, from the beta bacteriophage, that genetic material slowly it enters. See, it attached like this. The genetic material slowly it enters into the bacteria. See, it entered into the bacteria. Once it enters into the bacteria, it will attach with the bacterial genetic material. Look there. And what will happen? It will brainwash the bacterial genetic material, or it will stimulate the bacterial genetic material in such a way that it will code for a toxin called as diphtheria toxin. This is how Corynebacterium diphtheriae is releasing diphtheria toxin. And this diphtheria toxin is an exotoxin. So diphtheria toxin structure is like this. It has got two subunits. One is called A subunit and B subunit. So this A and B subunit, now it will enter into your body and it will attach to any one of the cell in my body. After attachment, what will happen? My cells, they take up this inside. They think it is a good thing, maybe let us take this inside, and they'll take up inside and form a vesicle called as endosome. Within this endosome, now the pH slowly decreases. It means acidity is increasing. So endosome is highly acidic now. And within this endosome, the pH is decreasing. It means acidity is increasing. So this high acidic nature in the endosome, this high acidity will cause detachment of A subunit and B subunit, right? So A and B, both of them, they separate. The moment they separate, A subunit is so free that it can very easily diffuse and go outside, but B subunit cannot diffuse outside, right? So A subunit can diffuse outside, B subunit cannot diffuse outside. So that is the reason why only A subunit will diffuse out of the endosome and enter into the cytoplasm. A subunit has got what? A subunit is all the time attached with ADP, adenosine diphosphate. Now this A subunit with its own ADP will travel all the way and attach to elongation factor 2. When it will attach to elongation factor 2 will be inactivated. When it will be inactivated, there is no further amino acid progression or amino acid elongation. When there is no amino acid elongation, no protein synthesis. No protein synthesis, the cell will not work. The cell is useless. It is not making money, so it is useless. So obviously there will be cell death and necrosis. So overall, guys, the first point was diphtheria toxin. The last point was necrosis. So can I roughly tell that DT, that is diphtheria toxin, once it attacks your tissue, it causes necrosis? Can I give a final statement that diphtheria exotoxin causes necrosis of your tissues? Simple thing. Did you understand this? I hope yes. Now, this is the basic thing that is happening in you and me when we are affected with diphtheria. Now let us discuss this is the basic pathogenesis which you have to remember. Now let us discuss some more detailed of how it is causing diphtheria in the pharynx. You know, even diphtheria, not only the pharynx, it even affects your kidneys, it even affects your brain, it even affects your heart. Okay, so how is this exactly affecting? We shall go into little bit detail and finish up this topic. Okay, so diphtheria toxin, at the end it is causing necrosis. In between whatever is there, that was the mechanism which I explained to you. Now, how is it causing is that, let me explain it with a picture so that you will very easily understand it. Okay. So this is the basic human skull over here, right? Human face from the lateral side. And what I'm exactly trying to draw is that this is your nasopharynx like this. And this is your oropharynx. Nasopharynx and oropharynx, they join together to form laryngopharynx. So finally this comes all the way down like this, and finally it divides into two parts. All of you know, yes, and here are your lungs. Okay, so this is the basic picture which you need to know. This is the basic picture which you need to know. Okay, we have got the nasopharynx, we have got the oropharynx. Yeah, all of you know this. Come on, there is no need to mention, but let me. This is called as nasopharynx, and this one is called as oropharynx. Oropharynx, together they form laryngopharynx. That is why it affects the larynx. So how is it affecting the larynx? Now in the larynx, let me draw few cells here. These are the few minute cells that are located within the larynx. Okay, these are the laryngeal cells. Laryngeal cells, or simply I can tell these are the laryngeal mucosal cells like this. Okay, now you are talking to me. For example, there is a patient sitting in front of me and he came to the clinic. I am the doctor on duty, so I did not wear my mask properly, and the moment he comes to me, he greets me and he starts coughing at me. So when he starts coughing on me, all his respiratory droplets will directly, they are a very good direct entry into my nasopharynx. So as the respiratory droplets enter into my nasopharynx, they directly go and attach to the pharyngeal mucosa. Okay, so respiratory droplets, let me draw this thing with red color. These respiratory droplets, they, okay, not red, blue. Respiratory droplets, they start attaching to my mucosal cells of the nasopharynx. You see here, how are they getting attached? And what will happen? Tell me, these respiratory droplets are having what? Diphtheria. So, can I tell that DT stands for diphtheria toxin. Diphtheria toxin is directly entering into my nose. Yes, into my nasopharynx. And then it attaches to my oropharynx, right? And then finally it goes down and attaches to the epithelial cells of larynx. Once it gets attached to the larynx, what will happen? Previously I told you, diphtheria toxin causes necrosis. So by all these mechanisms of EF2 elongation, ATP, ribosylation, by all these mechanisms, finally the cells, the mucosal cells in the larynx, the epithelial cells in the larynx are getting necrotized. There is necrosis of these cells. So when there is necrosis of these cells, after a while, after 1 month or 2 months after this bacterial infection, look what is going to happen. There is complete necrotic tissue. You see, this is all the necrotic tissue which I am drawing. So there is severe necrosis of all the cells like this. You see. So after a lot of time, after sufficient time, what is going to happen is that this necrosis, as the tissue has got necrotized, when you open your mouth, you can see the necrosis there. So this necrosis, after some time, this necrosis will turn to a grayish whitish structure. That grayish whitish structure or a grayish whitish membrane is what called as diphtherial pseudomembrane. So right now my patient is having, look here, let me just mention it. Patient got affected with DT toxin, and these DT toxin entered where? It attached to my pharyngeal epithelium, right? After that, this DT toxin caused necrosis of the pharyngeal epithelium, and after some time this necrosis turned to a grey adherent leathery membrane. I mean, this is how the scientists described it. It has a grey adherent leathery membrane, and this grey adherent leathery membrane, they described it as pseudomembrane. Now you might ask it out, can I call this as pharyngeal diphtheria? Yes, this is what is called as pharyngeal diphtheria. Previously I told you in the transmission part, if the respiratory droplets enter into your mouth, into your body, you will end up having pharyngeal diphtheria. How are you telling it is pharyngeal diphtheria? Yes, because in pharyngeal diphtheria I see a pseudomembrane. When I open the mouth, I see a pseudomembrane. Now, can you tell me something about this? Yes. When I tell the patient to open the mouth, I see a pseudomembrane and I try to scrap that. When I try to scrap that, when I put something in my mouth and I try to scrap that, then what is going to happen is that pseudomembrane, as it is coming out, it will bleed. Okay, bleeds upon scrap. Bleeds upon scrap. And there is another thing that is going to happen, guys. What is that? Another thing is, in some unfortunate cases, this membrane that is formed, that membrane might detach. Look here in the picture. Look here exactly in the picture. The membrane might detach like this. The membrane might detach and it can come down all the way like this. Look, it is coming down all the way. The detached membrane is coming down all the way right now. And it is coming down, and finally what is going to happen is that, look very clearly now, look at the picture now, it is going to obstruct your airways. You see, that membrane, that pseudomembrane detached from that pharyngeal mucus, came all the way down into your trachea, into your, finally entered into your one of the bronchi, right bronchus or left bronchus, in this case the right bronchus, and obstructed the right bronchus. So what will happen? Sometimes it can detach. It can detach and obstruct your airway. Now don't think, why is he not teaching about all the mediums like Loeffler medium, right? All this Elix test and all. I'll be discussing it later on. That is not the part which we have to discuss now. So they obstruct the airway, and finally what they cause? They cause asphyxial death. Sudden asphyxial death, right? Sudden asphyxial death. So this was the thing which we discussed. Now this is a DT toxin, which is an exotoxin, right? So it will cause what? It will cause necrosis. And finally, what is the membrane that is formed? The membrane that is formed is grey adherent leathery membrane, which is called as pseudomembrane. They bleed upon scrap, and finally they obstruct and cause asphyxial death, which is a very, very important complication which you need to know. Now let us go and look the pictures. Do you look at this picture here? In this picture, do you see this grey color thing? This grey color thing is nothing but called as pharyngeal diphtheria. Pharyngeal diphtheria. Okay, but what is this grey color thing? This grey color thing is what is called as your pseudomembrane. This grey color thing is what is called as pseudomembrane. And where do you see? In case of pharyngeal diphtheria. So from today onwards, if you see any patient, if you come across any patient coming directly to you and opening your mouth and telling, doctor, look what is happening, what has happened in my mouth, and you start looking at it, you find some grayish patch over there, and you take your spatula and you try to scrap it. When you try to scrap it, if it is bleeding, then right now take the diagnosis as Corynebacterium diphtheria, because only Corynebacterium diphtheria will bleed when you scrap. Remaining other bacteria, if you find any kind of membranes in the tonsil region, in the pharyngeal region, when you scrap them, they don't bleed, they simply detach. Okay, this is the thing which you need to know, right? This is a basic thing one has to know. Okay, so you told me so far that Corynebacterium diphtheria causes pharyngeal diphtheria. What can you tell other than this? What can I tell other than this is that, look here very carefully again. Let me draw the picture again. This was your nasopharynx. This is your oropharynx, and together they form laryngopharynx. Nasopharynx, oropharynx, and together they form laryngopharynx, right? So here we have got our lungs like this, and this is a place where you have got your cardiac tissue. This is your heart, for example, right? Not exactly, but okay, this is your heart. And down here you have got your let us say these are your kidneys. These are your kidneys, for example, and Up above when you go, this is your central nervous system. This is your brain. Now listen very carefully. Let me draw this also, and let us start the topic now. Start the different types of associated conditions with this diphtheria. So this is your, what is this? What is this which I am drawing right now? Now you must be knowing this. What is this called as? This is called as pharyngeal diphtheria, that this is a pseudomembrane, grayish pseudomembrane, right? Now the diphtheria bacteria, right? Look here now. This is your pharyngeal wall. Onto this pharyngeal wall, I told you there are cells like this. Okay. Now this diphtheria attached to these cells like this. Look, it attached to these cells like this. Got affected to the cells. Upon this, there is slowly what? Necrosis. This violet color thing which I am drawing right now is the necrosis, and that blue color thing which is present below is the bacteria. So this has affected only and only the epithelial layer, not deeper than that. But if you don't treat yourself, if you don't treat the patient well, then this bacteria slowly from the epithelium it enters so deeper. Look here now. It enters deep enough that in the deep layer of the pharynx you have got blood vessels. So this bacteria can very easily enter into the blood vessels as well. This bacteria can very easily enter into the blood vessel as well. So let me draw these blood vessels over here. Look here. Let us say this, there is a blood vessel over here. All the way there is a blood vessel coming down here. Now don't ask me the anatomy because this is not an anatomy class. So the blood vessel comes all the way down like this, okay, and this blood vessel surrounds the heart like this very nicely, and this blood vessel splits into two like this, and it supplies to your kidneys as well. Okay, this is just a schematic diagram. Now what is happening? What is happening is that this bacteria from the pharynx, look here very carefully, this bacteria from the pharynx can enter into your bloodstream. It can penetrate deep enough, it can cross the epithelium, it can cross all the muscle layers, and finally it can enter into the bloodstream. Now once it enters into the bloodstream, look very carefully. This bacteria can go up like this, it can go up, okay. This bacteria is going up, and finally what is happening? This bacteria is even affecting your brain. Bacteria even affects your nervous system. Okay. So what is bacteria doing, guys? Bacteria is affecting your central nervous system. Not only that, the bacteria even goes down like this all the way. The Corynebacterium diphtheria goes down all the way. And as these arteries are attached to the heart, even it will damage the heart. So even you see a pathology in the heart as well. Only heart? No. Even as this bacteria is passing down into the kidneys, you can even see a pathology even in the kidneys. So even you have a renal problem. Okay. You told me there is a problem in the heart, kidneys and the CNS. What are the problems? Can you tell me please? Yes. What are the problems are? The moment the bacteria enters into the CNS, it will cause nerve demyelination. This is your beautiful neuron over here. This is your neuron. And tell me guys, surrounding the neuron, what do you have? What is this thing which I am drawing surrounding the neuron? This neuron is a myelinated neuron. So this myelin is made up of a lipid, right? This myelin is made up of a lipid. Very good. Now look here. What is basically happening is that once this bacteria enters into the central nervous system, in the central nervous system, it will damage all the neurons. What do I mean by it will damage all the neurons? Is that it will damage all the myelin sheath. All this green color thing which I have drawn surrounding the neuron, it will damage all the myelin sheath. If myelin sheath is damaged, do you think the neuron will work properly? Do you think the conduction will be very fast in the neuron? No, there will be delay in conduction, right? So can I write for a note, can I take a note that in the central nervous system it will cause nerve demyelination? Yes, it will cause nerve demyelination, and this will result in polyneuropathy. This will result in polyneuropathy. Second thing is, I told you even it will affect your heart. How is it affecting your heart? How it will affect is, the first thing it is going to cause is myocarditis. Myocarditis. In severe forms, myocarditis, what will happen when there is myocarditis is that, see guys, if there is electric powerhouse, there is a lot of electric circuits within that house, right? So if there is heavy, you have to maintain a perfect ceiling. If you are not maintaining perfect ceiling, when there is rainy season, when there is a lot of rain, the rain will leak into the house, it will enter into the electric circuits and cause short circuit. The same thing is happening here. Myocardium has got affected. If you are not treating it, the infection will enter into the atrium, into the ventricles, and the infection will even enter into the SA node, into the AV node, and it will cause electrical depolarity. It will cause electrical disturbance. So can I tell myocarditis will progress to arrhythmia? The rhythm of the heart is changed because the electrical activity is changed. Heart is not pumping normally now. So that will finally lead to heart failure. Heart failure, right? So what is happening? Patient is going to have myocarditis, that will cause to arrhythmia and finally heart failure. Okay, in the renal, what do you see? What do I see in the renal is that patient is going to have acute tubular necrosis. There is a condition, yes, there is a condition called acute tubular necrosis. So what is happening in this acute tubular necrosis is that the kidneys won't function. When the kidneys won't function, the kidneys will not excrete urine. So when the kidneys will not excrete urine, this condition you call it as oliguria. This condition you call it as oliguria. So if you want me to make a separate table for that, very simple. Diphtheria, it forms pseudomembrane. We are clubbing up all the things to avoid the confusion, guys. Diphtheria, this forms what? Pseudomembrane. Okay, so diphtheria mainly affects three parts. Diphtheria mainly affects three parts. What are these three parts? One is it affects your respiratory system, right? The last one is cutaneous, and the middle one is systemic. When it comes to respiratory system, I told you the type of respiratory part which is affected is the pharynx. It will cause what diphtheria? Pharyngeal diphtheria. Look here now, it will cause laryngeal diphtheria and it will cause fascial diphtheria. Keep in mind one thing, guys, this fascial diphtheria which I have written here and this laryngeal diphtheria which I have written here, out of these two, fascial diphtheria is the most common and laryngeal diphtheria is the most severe form. Okay, so fascial diphtheria is what going to result in bull neck. I'll show you bull neck in a minute, but trust me that fascial diphtheria is causing bull neck. Now when it comes to the systemic, all of you very well know systemic in the sense it will affect three parts. It will affect three parts. One is your heart. It affects your kidneys. And it affects your central nervous system. Okay, so it is affecting your heart over here, your beautiful heart. It is affecting your beautiful kidneys, and even if it is affecting your central nervous system. When it will affect your heart, you know what is it going to cause. In the kidneys, you know, and the CNS also, you know what is it going to happen. So finally, we are going to discuss now the diagnosis. Yeah, and I forgot to show you this thing, the pictures of what? This is called as bull neck. So, this condition which you see here, this is called as bull neck, and this condition which you see here, this is called as cutaneous form of diphtheria. This is called as cutaneous form of diphtheria. Now, the diagnostic part. Now, how do you diagnose this case? How do I diagnose this case? Is I use two mediums. One is called as Loeffler's medium, right, and other one is called as PTBA medium. Okay, so what are the different types of media I use? I use two mediums. One is called as Loeffler's medium, another one is PTBA medium. So what is an important thing which you need to know? What is an important thing is, in Loeffler's medium I can look at the metachromatic granules very clearly. So better look at metachromatic granules. So where do I find, where can I study metachromatic granules very nicely? I can see it in Loeffler's medium. Then what is about PTBA? PTBA forms black color colonies. Black color colonies. I have shown you the picture of black color colonies, right? You see these colonies over here? You see these colonies? These colonies are called as black color colonies. And where do you see these black color colonies? You see it in, yes, PTBA medium. PTBA medium, I see specific type of colonies, and these colonies are called as black color colonies. And finally, there is a last medium that is called as, so this is 1, this is 2, and finally a last medium that is called as Tinsdale medium. That is called as Tinsdale medium. Okay, Tinsdale medium is nothing but combination of cysteine and tellurite agar. Cysteine plus tellurite agar together forms a Tinsdale medium. Okay, in Tinsdale medium what will I see? What will I see is, I see black colonies with brown halo. I see with brown halo. Black colonies with brown halo in the sense, there will be a black colony in the center like this. Okay, there will be a black colony in the center. So there will be a black colony like this. Surrounding this black colony, I will find a brown color surrounding like this, a brown halo. So black colony with a brown halo, you basically see this in case of what? Tinsdale medium, right? Let me show you a picture. So this is the black colony. Look at this picture. You see a black colony in the center. Surrounding that you see a brown halo. So this one you see in Tinsdale medium, right? Tinsdale medium.